Okay, well, good morning, everyone. Thank you for joining us today. My name is Deaton. I'm the Chief Operating Officer for Ballad Health. We'll say thank you to the media for being with us today. Especially want to say thank you to the team members and all the great work that we have across Ballad Health. As you know, we've been providing these briefings since August of last year, or August of this year, and then March the prior year. And our goal has really remained the same through these briefings, and that is to provide our communities with the very best information and most updated information regarding COVID-19. And we remain committed to doing that. Our overarching message to our community is to remember that COVID-19 is a significant threat to our community, and we encourage everyone to get vaccinated as soon as possible so we can stop the spread of COVID-19 across the region. As we move into the next stage of fighting COVID-19, we have to face the reality that we're going to be living with COVID-19 for quite a while. This will be part of our daily lives for some time to come. And so we're going to adjust these briefings to start meeting every other week so that we can do some other types of communication, more of a one-on-one type of communication through civic meetings or with businesses and with faith leaders. We think that's a really important way for us to continue to communicate. But we'll continue to provide our daily scorecards like we have been, and providing information to the media and to those across our community who are requesting that. I encourage you all to continue to stay up to date on COVID-19 situation through our website and through the other news releases we prepare, and through social media and through the media itself. And we will continue to share that information. We're committed to that. So let's go ahead and review the scorecard for today, if we could, please. So today we have 324 patients across our hospitals. That is down since a couple of weeks ago, and I'll share the specific numbers in just a moment. Of those, 97 are in the intensive care unit, and 73 are on ventilators. We have 15 patients under investigation awaiting test results. We have 3 pediatric patients in Ice Lumber Children's Hospital with COVID-19. We continue to utilize our Safer at Home program that helps care for patients at home through our telemedicine abilities. So when you combine the in-house patients with the Safer at Home program, we're caring for 526 COVID patients across the region. Our regional positivity rate remains right at 21%. We are seeing some lower numbers, as I said, which that were higher than the surge we had a few weeks ago. So that's very, very good news for our region. As we go forward, we move into the fall, and we start seeing people move back inside more. We see more events happening, and with the holidays, we do expect we could possibly see an increase in cases again. So again, we would ask you to get vaccinated as soon as possible to prevent the spread. We are going to continue to prepare for a relatively high number of COVID patients in the hospital. I know that we're seeing in other parts of the country, even though the surges are slowing down, we are seeing some fairly high census numbers across facilities. So let's go ahead and go to the data pack that we have. So you can see now our cases have reduced or declined significantly over the last 2 weeks. 8,000 was our peak, 8,030. We declined this week down to 4,000, right at 4,700. That's about a 40% drop since that period. Since last week, we've dropped about 20% in the number of cases. So very good trend now of declining cases. Let's go to the next one. So if we look at the number of cases in-house, this is the trending of that data. And so we're down to 324 patients in-house, as we showed right here. Our high was 413, which was higher than our previous surge that we saw before. You can see now that our overall hospitalized patient has an average age of 62.1, and our average age of the vaccinated is at 69 years of age. Those who are unvaccinated, the average age is right at 62 years of age. So, as I mentioned, our Safer at Home program continues to be very important and successful to helping us create and relieve the compression of patients inside the hospital. So today we're treating and caring for 187 people at home, and we continue to see that as being very, very effective. We can go to the next one. Okay, not moving.
Sorry, give me 1 second.
I'll just work on this. No worries. We'll share this data pack online for everyone. We've had a little bit of technical difficulty this morning. Monoclonal antibodies, we've talked a lot about that, and we are seeing that being a very effective way to care for patients. So far, since we started this treatment, we provided 2,739 doses of monoclonal antibody treatment. This past week, we provided right at 300 doses. We continue again to see that as an effective way, and so typically we see somewhere around 300 cases per or doses per week that we're providing to our community. Okay, we try that again. We go to the next one. Okay, so again, this is the safer at home and the inpatients, and as I said earlier, we're seeing somewhere around 520 or so patients that we're caring for combined. Okay. And then, as we've seen before, we're comparing the previous surge we had to the current surge. We have now intersected with the previous surge that we had, currently at 324. Remember, our previous high surge was at 361. I think this one was at 416 was our highest surge before. So we're starting to see a really good downward trend. It will probably do like before, where it'll level off and then continue to drop down moving forward. Unfortunately, we do see a high number of deaths being recorded this month. The deaths that are occurring across Ballad Health, almost 36.5% of those deaths are related to COVID-19. That's the highest percentage we've seen so far. We do expect, unfortunately, to see this month being the highest number of deaths we've experienced so far since the pandemic. So, again, very concerning. The people that are in our hospital are very, very sick, and we're seeing just a continued increase in deaths across the region due to COVID-19. As I mentioned before, our positivity rate is at 21.2%. This is down from our higher peak of around 23%. You can see again some of the higher positivity rates are in some of our rural counties: Hancock, Hawkins, Carter, Unicoi, all around 20% or higher. And so, and typically those are also the counties that are not vaccinated with the highest number of community members there. You can go to the next one. So overall, we are seeing a slight increase in fully vaccinated at 42.6% now. Statewide, we're still falling behind the state of Tennessee at 45%, and then the Commonwealth of Virginia is at 60.2%. So we are seeing this start to inch up, but still somewhat lower than we would like to see compared to the others, especially. And so the more we can get vaccinated, the quicker we can move on beyond this. Then our modeling shows that over the next couple of weeks, we are starting to see really compression between the three different levels here of probability. So we think we'll probably remain in the next 2 weeks somewhere between 240 to 350 or so inpatients, and continue to see this downward trend starting to happen here. So as we've seen before, unfortunately, a lagging indicator of this pandemic has been deaths. 60 people have expired due to COVID-19 just in the last 7 days. And as I said earlier, 1 in 3 deaths that occur across the system are really related to COVID-19 complications. As you read the number of discharges on our scorecard, you may not know, but those discharges also include deaths that happened across our system. Again, we've seen more loss of life this month than we've seen in prior months. We do expect that to continue to increase over the next couple of weeks as we see the cases that we have had in the hospital before start to decline. An unfortunate other type of statistic is that nearly 50% of the people who are placed on ventilators expire and don't survive COVID-19. We have known for months that this primarily is made up of unvaccinated individuals. And obviously, as we all know, these are not just numbers. These are real people. And these deaths have a great impact on many lives. And we're very sorry for the loss of every single person that we have within our system. Today, I want to introduce someone really special to you. Heather Smith is with us. Heather lost her father a few weeks ago to COVID-19. I want to ask Heather to provide her story at this time. So, Heather, thank you for being here.
Thank you, Eric. Hi, friends. My name is Heather Smith, and I was born and raised here in East Tennessee. I went to Elizabeth High School and went to UTSU for college. And this is our COVID-19 story. This is my dad. His name is Leroy Garland. If you are in the baseball community in Upper East Tennessee, you might know my dad. He's been involved in the baseball community for as long as I can remember, umpiring Little League games, USSSA games, TSSA games. So this is for him. The week of July 9th, my entire family, one by one, was diagnosed with COVID-19, beginning with my mom. Then a couple days later, she's 63. A couple days later, my dad, Leroy, who is 61, my 24-year-old brother, and then finally my 93-year-old grandmother. My mom had received her first vaccination a couple days before her diagnosis, but upon returning to work on Monday, she discovered that they had been exposed at their workplace. My parents both work for the same business. My grandmother was fully vaccinated, so she contracted COVID and recovered fully. My dad and my brother were not. But my dad did not receive the COVID vaccination because he didn't believe in its efficacy or safety, or he thought that COVID was a hoax, or he had any unbelief. He did not receive his vaccination for COVID-19 because when he was in the Army 40-something years ago, he received a flu vaccine and had a terrible reaction to that flu vaccine that landed him in the ICU. And while he was in the ICU, those physicians instructed him to never receive another flu vaccine, which to the best of my knowledge, he never has. Most of you all watching this and everyone in this room knows that the world is full of misinformation about COVID-19. And many have likened the COVID-19 vaccine to the flu vaccine, which it is not. But because that information was out there and my dad bought into that belief, it never occurred to me, and honestly I don't think it ever occurred to him, to have a conversation with his physician on whether or not he would be eligible to receive the COVID-19 vaccine without having a side effect. So he was never vaccinated. And in my mind, and in many people's minds who haven't been vaccinated yet, they have their reasonable reasons to not be vaccinated. But I feel very strongly that had my dad been vaccinated, that he would still be here with us. So fast forward 23-ish days after my dad was diagnosed, he developed typical COVID pneumonia, which then progressed to acute respiratory distress syndrome, which basically means your lungs just cannot function appropriately to do the proper carbon dioxide and oxygen exchange. And then finally, he developed fibroproliferative acute respiratory distress syndrome, which is something that is, to the best of my knowledge, it is something that is a direct side effect from the COVID-19 virus. And friends, it is a horrible, horrible death to watch somebody that you love die from COVID-19. We were fortunate to be able to spend some time with my dad in his last days on Earth. And one of the things that really sticks out in my mind is that my dad, on his literal deathbed, on high flow oxygen, pumped all the way in a rebreather, reached up and grabbed my brother by the collar and said, "Get the shot." And so that has just left a permanent imprint on my heart and mind. So a lot of people think that people expire and die from COVID-19 because they have other comorbidities, or they're old, or whatever reason you want to fill in the blank with. But my dad was not overweight. My dad did not have comorbidities. My dad was only 61. He had a lot of life left. So our plea to you as a family, and Ballad's plea to you, is to please get vaccinated. We feel so strongly about this that when I wrote my father's obituary, which I pray none of you all have to do earlier than you intend on, is that we ask for people to get vaccinated instead of sending flowers, because we believe so much in the efficacy and the safety and the importance of the COVID-19 vaccine. So if you're on the fence, if you feel like you have a reasonable reason If you have questions, I beg you to please talk to your trusted physician, nurse practitioner, or physician's assistant to find out if you are eligible for the COVID-19 vaccine. And if you are, do not wait. They are readily available. They are free. You can go today. I do not want COVID-19 to be a thief to you and your family and your family's lives. Eric talked about a lot of statistics, and one of the things that really stuck in my mind throughout our time in the COVID ICU here at Ballad is Dr. Lawson said to me, we are not statistics. We are human beings. And while there are a lot of people that do survive COVID after they contract it, there are a lot of people that do not. And it is a horrible, terrible death. And I beg you to please go today, talk to your healthcare provider today, and get vaccinated. Thank you.
Heather, thank you for your bravery and for telling your story. I'm so sorry for your loss. And, I wish I could have met your dad. He's an awesome guy. And, the unfortunate thing is that this can be prevented. We know that. We know that the vaccines are safe. We've said that many times. You heard Heather's story. You heard the plea from her family. Please do the right thing and get vaccinated as soon as possible. There's really no replacement for vaccines out there. But for people who do get sick, we're going to do all we can to help you. One of the things that we have talked about that we've been doing most recently is the monoclonal antibody treatment. It is one of the best options we have for care and treatment of COVID-19. We've been using the antibody treatment for almost a year, and as I said, it's very, very effective. We still are providing those for patients who qualify. There clearly has been a large demand for this therapy across the really United States. You may be aware that there are some shortages that we're starting to see and changes in the way the supply process works. We so far are still getting a good supply of monoclonal antibody. We have several locations where you can receive this treatment. We have two vaccine center, two IV therapy centers set up across the system, and our emergency departments also provide this treatment. You do need to be referred by your physician for this treatment, by your primary care doctor typically. Appointments are usually scheduled within the same day of the order going in. So we will continue to obviously monitor and closely watch the supply of this because it is so important to the treatment of COVID-19. Okay, so some good news today I did want to share is that we will be resuming some of our same-day elective cases starting today. We do see as the decline in of inpatients starts to decline, we are able to resume cases, surgeries on a case-by-case basis. This will be based on by facility as space and the staffing allows that to happen. But many of our hospitals are starting today to resume same-day elective cases. Some will be starting next Monday. Patients who qualify for this, for their procedure will be notified by their physician and their physician's office. You do not need to call us. You'll be contacted by your doctor. Let's not remember that these elective cases do not mean they're not necessary. They're extremely necessary. They're extremely important to the person who had to defer that. Now I just want to say thank you. I'm very grateful for the patients that many people have had in having to defer these surgeries, and for our surgeons who have had to defer these surgeries. Again, these are very important procedures for people, and I know how difficult it has been. I have had friends who've had to defer surgeries, and we're very thankful that we can start to bring these back. I want to say thank you to the medical staff who have worked with us, provided much guidance through this, with their expertise and support as we've had to defer surgeries in recent weeks. Especially want to say thank you to many of the team members who have been have had to work in other locations. So many times our surgery staff have moved to the front bedside and have helped with our other team members who care for COVID patients. And I just want to say thank you for that great work. And we'll continue to support our frontline through internal staff as they need that to happen. Moving forward, we'll continue to monitor our COVID-19 inpatient numbers. As we see continued meaningful decrease in hospitalizations, we will continue to bring back more and more elective surgeries moving forward. So before I wrap things up and turn it over to Jamie, I do want to say a great thank you to our community. There's been just a tremendous outpouring of support we've received across our community. Everyone who has worn a mask, got the vaccine, thank you for your support of our frontline team members. Many of you have gone above and beyond in your support. One group I especially want to say thank you to is Region Ahead. They have been one of our biggest cheerleaders and supporters across the past 19 months and have done some amazing things to really support the frontline workers. They most recently have teamed up with the United Way of East Tennessee Highlands to create a fundraiser to benefit our frontline healthcare workers. So far, they've raised $40,000 to provide gift cards and meals to our team members. And it's just an amazing effort by many people across our community. If you would like to donate to this cause, you can go to their website, which is regionahead.com, and make a donation there. So again, thank you for that great work. This also, by providing these gift cards and meal cards, does help support small businesses in our area who have been impacted by COVID-19. I want to say a special thank you to many of our school systems who have implemented masking mandates over the past few weeks. It's not a coincidence that we see a decline in pediatric patients in our hospital or pediatric cases. We believe that the masking has worked. It has helped stop the spread of COVID-19, and especially I want to say thank you to those school systems who have helped with contact tracing to ensure that the spread was minimized. This pandemic has put an enormous strain on our entire healthcare system. Many of our hospitals are very busy, especially the emergency departments, on a day-by-day basis. We will continue to focus on taking care of people as they enter our ERs. Let me remind you, if you only need a test for COVID-19, please don't go to the ER for that test. If you do need care from the emergency department, please go to the ER if you need that. If you're just seeking a test for COVID-19, there's many locations to go to get a COVID-19 test. Our team members continue to strive every single day to provide the very best care possible. Sometimes the wait times are longer than we expect and that our patients expect, and we're sorry for that. There has been a large increase in the number of patients entering the ER, but we will continue to do everything we can to expedite care across the system. And we appreciate your patience as we work through this. So let me at this time turn it over to Jamie Swift, our Chief Infection Prevention Officer. Jamie, thank you.
Thanks, Eric. I want to thank everybody for joining us today. And as always, thanks to our team members that are out there working extremely hard. While we are obviously thankful our cases have not increased, our staff is still strained trying to care for the nearly 350 COVID inpatients. As you can see, almost 100 of those are on ventilators. The data continues to show the strain on our system. The deaths, the ventilators are largely stemming from unvaccinated individuals. As of today, 305 of our 324 COVID-19 patients are unvaccinated, or about 94%. That percentage is even higher for patients receiving critical care. 97.9% of our COVID patients in the ICU are unvaccinated. 72 of the 73 on a ventilator for COVID-19 are unvaccinated. As Eric mentioned, the average age of our vaccinated patient with COVID-19 is about 69, while the average age of the unvaccinated patient continues to drop to 61. As you've heard, we've seen a drop in those pediatric cases, which we do attribute to those school systems implementing those masking policies. We know masks work, and we know that the vaccine works. It's important to keep that information in mind as we head into the holidays. If you remember last year, we started seeing those peaks after Halloween and Thanksgiving. That can be prevented this year. We can prevent that with masking. We can prevent that with the vaccine. There's still time to be fully vaccinated before Thanksgiving if you will seek out your shot and seek that out now. We're really encouraged that the vaccination may soon be opening up to an additional demographic. You've likely heard that Pfizer announced that their COVID-19 vaccine are safe and effective for children as young as 5. That trial tracked more than 2,000 participants in that age group and found that children who received the vaccine had a robust antibody response. The FDA has not yet given that EUA. They're currently reviewing that information. We are hopeful to see that EUA given for 5 to 11 this month or early into November. That is excellent news. That means that the overwhelming majority of our school-age children will have safe, effective access to the COVID-19 vaccine by the end of the year. We strongly encourage parents to start having those conversations. Talk to your pediatricians, reach out to Ballad Health, let us help you make that decision to move forward to get that vaccine for your child. It's true that typically children recover from COVID-19, but as you've seen, we've seen higher levels of hospitalization through this Delta variant, through this surge. We even still have children on ventilators. We don't want more children's lives at risk. To get those vaccines, we want to remind everyone that our Ballad Health continues to offer the COVID-19 first and second doses for everyone 12 and older. At the mall, we also have those boosters for 18 and older. The center is open from 11 to 6. We did expand those hours to help meet this demand as we go into the booster doses. We've expanded those hours, so it's 11 to 6 on Tuesdays, Wednesdays, and Thursdays there at the mall in Johnson City. We do have those third dose for immunocompromised as well as the boosters that are now approved. So booster doses, again, Pfizer vaccine, which is what we have, healthcare workers, teachers, anyone with a high-risk occupational exposure, anyone over the age of 65, and then those people 18 and older who have those underlying conditions that put you at greater risk. You're eligible for a booster if it's been at least 6 months from your second dose. These shots are available to anyone who meets that criteria at this time. Boosters are not approved for J&J and Moderna. Still have good protection. We don't want you to worry. We do think the information from those companies will come soon, but this time the booster has to be that Pfizer dose. In our hospitals, we're providing those booster doses to our team members, so you're not going to have extra wait as we try to get our team members through. We're taking care of our team members within the hospitals. Just this week, we've already provided close to 500 booster shots, which is very promising news. I'll always close by talking about flu season. We're very much heading directly into flu season at this point in time. So please, now getting your flu shot is as important as ever. Really, October is the ideal time to do that. So if you've not made time to go get your flu vaccine, please do that. You can go to local pharmacies, your physician's offices, call around, find that appointment, and go get that flu vaccine. That's all I have, and I will turn it over to Eric.
Thank you, Jamie. We'll open up for questions at this time, and I think we also have Dr. Runnels and Lisa Smithdahl with us today if we have questions for them. So, Ashley?
All right, 3 each, starting from
First thing I wanted to ask about the boosters. I've had some confusion myself. Reading the CDC's guidelines, they make a distinguishment between over 50 and under 50 based on individual benefit versus risk. What does that mean, and how do you determine with that whether you should get it or not?
It really is. They really say 50 and over should get the booster. We know that especially as you get older, you may have more waning in that protection. So absolutely 50 and older should if you have those underlying conditions. They're saying that 18 to 49 may, and so it's open to those people that have underlying conditions in 18 to 49. They do encourage you to talk to your physician. You can certainly talk to us at our vaccine sites. And we'll kind of talk about what those underlying health risks are, and if you want to go ahead and proceed with vaccine. It's approved, you can. They just want you to know you don't have to rush out and get it. You certainly can consider it, look at your individual risk, and go ahead and make that decision in conjunction with your medical provider.
Is there any harm to erring on the side of getting it if you're unsure?
There's not, and that's really why they went ahead and gave that leeway to the patient. So it's safe, it's effective, the trials prove that. We know we're going to get that boosted immunity. So that's why they went ahead and opened it up to that age group as a May.
Honestly, I don't have a lot to ask today, so that makes it all.
So is your first few days administering the booster shots. How did that go?
Our research have went extremely well. One thing that we've tried to stress to people is this is very different from the first rollout. So if you remember when we first rolled out vaccine, the supply was short, not everyone had it, and supply is not the issue for boosters. And so we don't want people to be scared away thinking there's going to be hour-long waits. There's not. There's plenty of vaccine supply all across the region. So we had a good steady stream at the mall yesterday, not an overwhelming demand, so people can still walk in, get their booster dose, and get out pretty quickly.
And then my other question is, can y'all provide more specifics on the same day surgeries that you all are resuming? Because I know you said some, so what does that mean?
Yeah, typically it's those cases that are not overnight, they're the same day type of a case. That'd be something like an orthopedic case or a hernia repair, something like that, that would be in and out the same day. And it really does depend, again, case by case, as we take in the physician, along with the patient, we're making that determination. The overnight stay could mean that the patient may have some comorbidity issues where they require an overnight stay just for monitoring and so forth. But it really is a physician decision that they make with their patient. But typically it is those surgeries that are in and out within the same day.
Okay, and then my last question is, I know deaths are at their highest point. What has made it possible to resume these surgeries?
Well, it really has been because our census has started to come down. We're running around 22%. And remember, our goal has always been to be at 20% or below when we resume surgery. So this is a stair-step type of method. We're down to about 22% of our total COVID patients for our total number of patients across the system. So as that continues to drop, we'll start to increase more. So really what happens as the inpatients drop, it allows us to have more of our team members who are deployed to front lines come back into surgery and start helping do that work again.
Also asked about the monoclonal antibodies. Are you tracking how many of those patients are vaccinated versus unvaccinated and kind of where that trend is?
Dr. Reynolds, do you know that? I can. Okay. I'll let Dr. Reynolds address that. Thank you.
I don't have those numbers exactly. The vast majority of these patients are unvaccinated that we're providing it to, but there are cases where patients may have immunocompromising conditions and they've been vaccinated and they're still at high risk because of their age or other health conditions. So there are a small percentage. I don't know that exact number. We can get that, but it is an individual physician's choice as to assessing the risk and prescribing it, because we require a physician's prescription for that. So the physicians are making that determination based on their individual risk of the patient.
And you may be answering this next question too. I don't know. Your cases are dropping off. Your ICU cases are staying relatively stable. You've had basically 100 patients in ICUs for a month, basically. Do you see that trend starting to tail off too, or what's the forecast for that? And what's the impact then of having that many sick people week after week?
Well, so there's several questions in there, but this is sort of expected in that patients that are sicker are obviously going to be in the ICU. Patients that are in the ICU are going to stay in the hospital longer. So as that surge came in and some became sicker and ended up in the ICU, their length of stay is going to be longer, whereas the ones that recover go home. So you start to see a decline in total census. The ICU numbers will come down slower. So that's sort of expected. We would expect that. It is a tremendous burden on the healthcare teams that are taking care of those patients, and on the hospitals to continue to have a large number of critical care patients. And unfortunately, the survivability goes down for that group as well. And so we'll continue to see a number of deaths. We'll continue to see a longer length of stay for those patients that are in ICU, but they will eventually come down as the total number of infections and the total number of patients being admitted declines.
Okay. Nice.
Jonathan?
Yeah, hard question to answer, but it seems we're on week 3, I believe, of a pretty steady decline or flattening. Do you think the worst of this surge may be behind us at this point?
It appears to be. I think it's starting to come down, and so I guess to answer your question, we have seen a trend of downward number of inpatients. So that trend has been sustained, as you said, over about 3 weeks now. So we do think we've seen the worst of this particular surge. I would caution people that we still have a lot of COVID-19 positives in the area. It still can affect a lot of people out there. So the best thing for us to do is to get the vaccine. I am concerned as we move into the winter months, where we move inside, if people are not masking appropriately, if they have not gotten the vaccine, I think we could potentially see another surge in the winter, like we saw last year. So although I'm optimistic we are seeing decline based on the data we've seen, I think we could see that surge again, just based on people coming together again and moving more inside.
And building off of that a little bit, what do you think is, I guess, the primary cause behind this decline? You know, cases are down, but admissions still seem fairly high. I'm wondering if maybe that's just due to the sheer number of people dying and the number of people you guys are referring to the Safer at Home program.
I think it's a combination of all those things. I think we've seen the effectiveness of the monoclonal antibody. We've seen the effectiveness of the Safer at Home program. We are seeing an increase in people taking the vaccine. We're seeing more masking. I went to an event last night. I was so concerned about it, but every single person there had on a mask. I thought I was happy to see that. It was inside. And so I think we're seeing people continue to understand it's important to take precautions. And so, and a Delta variant, we've seen other places, there's been a spike and then a decrease. So I think this variant is kind of following what we've seen in other parts of the country right now.
Gotcha. And then last thing on monoclonal antibodies, it is possible that there will be a pretty tight constriction supply for most of the southern states, including us. How, if at all, are you guys able to prepare for that constriction?
But we continue. I think that one of the big things to do is make sure you're using it. So they have tried to replenish that supply as we use it. We're being very assertive, making sure that we are able to get that out there, providing options and availability of it. So we'll continue to do the best we can, working with both Virginia and Tennessee to provide that vaccine to us. So I think communication with the states on the need for our region is important as well.
Gotcha. Thank you.
Okay. Open up to the phone. We are going to start with Spencer.
Yeah, so you all mentioned that your patient level is still over 300. Obviously, you would like that to be zero, I would assume, but what is sort of a comfortable patient COVID inpatient level for Ballad?
Well, the question was, what's a comfort level? What census would be make us feel comfortable to care for? I think you're right. We want to be at zero. So, but we do know that we'll probably have COVID patients across the region for some time to come. We have to start working towards now. We're actually doing that to understand that we may have as many as 200 patients in the hospital for some time. And how do we continue to make sure that we can continue having elective surgeries? We can't stop elective surgeries every time we have a surge. So one of our next goals that the Emergency Operations Center is really working on is creating capacity to make sure we do not have to stop elective cases again. And so we may have to cohort more COVID patients at some of our tertiary hospitals or other locations so we can resume operations across the system. But I don't know if there's any comfortable level of COVID patients within the system, but I do trust that our team does an amazing job at caring for these patients. We do have good supply of PPE, so I'm satisfied with that. But we'll continue working through it on a day-by-day, week-by-week basis to manage it.
Yeah, and there's obviously been a lot of talk about variances that the Delta variant came through, and we seem to be on the backside of that wave now. Is there any worry from Ballad? Have you heard anything about new variants that may be coming through? I mean, obviously there's talk with other variants, but are any of those a cause for concern for you all that we could end up in the same situation that we had with Delta due to another variant?
I have not heard about other variants that we're really concerned about right now, but I may let Dr. Reynolds, if you have anything on that, or Jamie, if you have something I don't have, I'll ask Jamie to address other variants.
Okay, so this is something I keep my eyes on constantly, the other variants. You probably heard about the new variant. It does not seem to be taking over Delta, so it didn't seem to be that it's going to come and replace Delta, which is good. Obviously, the biggest concern we would have, which we have not seen, would be a variant off of Delta, and we've not seen that yet. The issue is, as Delta continues to spread, every time it spreads, that allows for variants to happen. So that's why we stand up here and continue to push for masking and vaccine to really try to limit this spread. You limit spread, and that's how you stop variants.
All right, thank you.
All right, Spencer, anything else?
I don't believe so.
Okay, cool deal. Richard?
Yes, just a question go to Eric. Any more guidance on whether you all might make the vaccine mandatory for employees, or are you still examining that in light of the White House rule?
Yeah, the question was, are we considering mandating a vaccine, or are we still following guidance from the White House? Richard, we're still continuing to follow the guidance from the White House. We are not looking to mandate this at this time. And I just want to remind everybody that the mandate or the guidance from the White House was either to be tested routinely or to get the vaccine. So it wasn't necessarily a mandate for the vaccine. But at this point, we're still waiting and watching to see what is done from the Biden administration before we do anything at this point.
Okay, thanks. And a follow-up, any more National Guard help on the way, or with the numbers starting to level off, are you satisfied with what you've got so far?
We're very happy, very pleased with the support we got, and I'll let Lisa Smith actually enhance this up for us. I'll let her speak to the National Guard availability.
Thank you, Eric. So we did receive some federal designated National Guard for Holston Valley, in addition to the 20 that we had already at Johnson City Medical Center, and they arrived on Friday, and we are anticipating a few more to arrive at Holston Valley in the next few days. So we're really excited that they are here to support us, and we will keep them as long as they permit us to keep them. As we continue to have a trending down, and if we reinstitute all of our other services, we likely will no longer be able to have the National Guard, but certainly we are gracious that they're here, and we'll continue to use them as long as they are.
What about our special guest coming tomorrow?
And tomorrow we're going to have the Tennessee Adjutant General. He's the top National Guard person for the state of Tennessee, and he's appointed by the governor. He'll be visiting Johnson City Medical Center and the troops that have been helping us out there tomorrow morning.
Thank you, Lisa.
Okay, great. Thank you.
Thank you, Richard.
Okay. Richard, anything else?
No, that's got it. Thanks as always.
Okay, thank you all.
Thank you all very much. Appreciate it.